Child Trends. On behalf of the Family and Provider Teacher Relationship Quality Project, or FPTRQ, we'd like to welcome you to this webinar. The project offers unique tools for measuring the relationships between families and the providers and teachers who care for their small children. And as you know, these relationships are a key factor in promoting positive outcomes for children. The FPTRQ project is funded by the Administration for Children and Families Office of Head Start and the Office of Planning, Research, and Evaluation. The project has been led by Westat and by Child Trends. Westat is a research organization that for more than 50 years has specialized in statistical design, data collection and management, and research analysis. Child Trends is a nonprofit research organization that for more than 35 years has produced and disseminated research, data, and analyses on programs, policies, and issues that impact the well-being and the lives of children. Throughout the webinar, if you have any technical questions, please submit them online. You'll notice on your screen there's a box on the right-hand side, and you can submit questions to our team, and they will get back to you. That's also the same place where you can submit questions to our panelists throughout the webinar, and we will queue them up and present them to them after they've completed their presentations. Today, you're going to be hearing from several panelists. You'll first be hearing some introductory remarks from Dr. Laura Hoard. She is a social science researcher and analyst at the Office of Planning, Research, and Evaluation. She has served as a project manager of this program in that office. Then you'll hear from the 4 researchers who have led and conducted the research and the development of these measures for this project. So in the order of that they will speak, you will first hear from Dr. Lina Guzman. She is a senior researcher and director at Child Trends with expertise in measurement development, among other areas. She has served as a co-PI to this project. Toni Porter from Early Care and Education Consulting. Formerly, she was a senior researcher at Bank Street College of Education. Toni's research focus has been in home-based child care, conceptualization and measurement of family-provider relationships in early care and education, as well as evaluation of ECE programs. Then you will hear from Dr. Manica Ramos. She's a research scientist at Child Trends and project manager for this project. Manica has her doctorate in applied developmental psychology and specializes in research on early care and education programs, family engagement, and cultural sensitivity. She also brings to this project an expertise in survey development. And finally, you will hear from Dr. Kwang Kim, who is the project director for this project. Kwang is a senior study director at Westat. His research experiences in survey research, early education research, and implementation of large-scale data collections and data analyses and reporting. He holds a doctorate in education research. I will now turn it over to Laura for her introductory remarks, and then Lina Guzman will kick off the presentation.
Thank you. Hi, everyone, and welcome. We're really excited to be at this phase in our project. And I just wanted to give you a little bit of background about how we got to where we are now. As you know, family engagement has been a cornerstone of Head Start since its inception. And the focus on family engagement across early childhood education programs has recently gained more prominence. This has been seen, for example, in state QRIS systems, seeking better ways to measure family engagement, and also with the focus for Race to the Top grantees on this area. 5 years ago, as family engagement was beginning to gain attention and interest across different kinds of programs, OPRE, the Office of Planning, Research, and Evaluation, in collaboration with the Office of Head Start and the Office of Child Care, held a 2-day meeting that was had researchers, policymakers, and program staff discussing what the next steps in the area of family engagement in early childhood education needed to be. And the consensus from the meeting was that what there really needed to be was a good measure of family engagement. It was also determined that not all programs had the same expectations or requirements for family engagement, That said, good family provider relationships were something that all programs needed to build and were key to having good engagement. Luckily, at that time, the Office of Head Start had funds that they wanted to put towards building better measures of the quality of early care and education programs. And seeing the need highlighted by the meeting for the better measures of family engagement, Office of Head Start and OPRE used the funds to create the FPTRQ project, which you will hear about today. It's important to note that the Office of Head Start was really interested in broadly in supporting the development of measures that could be used in a variety of early childhood education programs. So this will be applicable, which you'll hear, in center-based child care, family-based child care, as well as Head Start centers. And I wanted to mention someone that I've worked with very closely on this and has been a lead over at the Office of Head Start but couldn't join us, which is Kiersten Beigel. She is in charge of, she's a family engagement lead and serves as a federal project officer for the National Center on Parent, Family, and Community Engagement. And I would really encourage folks to have a look at their webpage over on Head Start. It's got a lot of information about family engagement that would be of interest to folks today. And with that, I will pass it over to Lina.
Thank you, Laura, and good afternoon, everyone. We're delighted to have you joining us virtually so that you can hear about the new family provider-teacher relationship quality measures. The measures that you'll be hearing about today are the culmination of roughly 4 years' worth of work. They were developed through a multi-step and iterative process that you'll be hearing about, and we believe led to very rigorous and reliable measures. Before we get started, let me just take a moment to run through what we'll be covering today. We'll begin with a brief introduction of the project. We'll then describe the conceptual model that guided the development of the measures. We'll describe the measures that were developed, as well as the pilot and field studies that were conducted, and the psychometric analysis that was done to assess the reliability of the measures. We'll then discuss the various uses of the measures, as well as the development of a measure that was specifically for family services staff in Head Start and early Head Start programs, as well as the limitations and implications of the measures. Next slide, please. So the project was carried out in partnership between Westat and Child Trends and is sponsored by the Administration for Children and Families, Office of Head Start, and OPRE, as Laura mentioned earlier. The purpose of the project was to develop measures that could be used by practitioners, policymakers, and researchers to assess the quality of family provider-teacher relationships in early care and education settings for children birth to age 5. More specifically, a key goal was to develop measures that could be applicable across diverse settings that were appropriate for use in racially, ethnically, and economically diverse populations. And just to be clear, the measures that we developed are applicable across centers, family child care programs, as well as Head Start, early Head Start, and pre-K. I should note that while the measures were not explicitly tested with pre-K teachers or parents with children in pre-K, public pre-K programs, we have no reason to believe that they couldn't be used in those settings as well. So to this end, we developed 5 separate measures depending on the respondent and target relationship. The first is a measure for providers and teachers that asks them about their relationship with their families, the families that they work with. The second is a measure for parents that asks about their relationships with their child's provider or teacher. And the third is a measure for directors that collects information about sort of the center's characteristics and features. And we'll talk more about that as well. And fourth is a measure for family services staff about their relationship with the families that they have in their caseload. And the fifth is a measure for parents about their relationship with family services staff member. Next slide. So why do we need a measure of family provider-teacher relationship quality? Well, as you know, 60%, roughly 60% of children in the U.S. spend time regularly in early care and education settings. And we also know that children's provider and teachers can lead to positive outcomes such as school readiness, increased positive family engagement, and strengthening family program connections, which are an important contribution to child success. Yet, there is no currently available or single measure that's available that incorporates all elements of provider-teacher relationship quality, such as knowledge, practice, attitudes. And while there are a variety of measures that assess different aspects, no measure currently available measures all the aspects. Additionally, many of the measures were not developed, designed, or tested for diverse populations in terms of either economics or race ethnicity. And nor are many measures also available, nor are there many measures available in Spanish. In short, there was a need for a measure of family-provider relationship quality that includes all elements that the empirical literature suggests are associated with positive child, family, and provider-teacher outcomes, as well as one that was applicable across a multitude of settings and applicable for diverse populations. So the new and comprehensive family-provider-teacher relationship quality measure fills this critical gap. It also informs programmatic and policy directions for how to measure quality in family-provider-teacher relationships, as well as family engagement. And lastly, it contributes to our knowledge base about the associations between specific elements of effective provider-teacher relationship in terms of how to build those relationships with their families. Next slide. And so as you can see here, we had a multiple-step process to develop the measures, and these multiple stages were very iterative in nature, and by that I mean that if we experienced a bump in the road, we sort of stopped and went back to our early stages to see what we might have missed or what we could be doing differently. So the steps included a very extensive literature review that helped to develop our conceptual model, which Toni will be talking about in a moment. Focus groups with parents, providers, directors, and family services staff to help confirm that our conceptual model included the key elements that these various groups believed or experienced to be critical to building family-provider relationship quality. We also consulted with experts across the country, and we did an extensive review of existing surveys to help us identify items that we could use, items that we could adapt, as well as gaps in the existing measures where we needed to develop a measure from scratch. We also did multiple rounds of cognitive testing with parents and teachers, as well as family services staff. And the cognitive testing was intended to help us assess how well the questions were working. So when we asked people a specific question, we would ask them, for example, how they interpreted it to make sure that their interpretation matched what the interpretation that we had intended. And lastly, we did a pilot and field study, which Kwang will be describing, as well as psychometric analysis to understand the statistical properties of the measures. One important point to make here is that when we began the project, we did not anticipate or expect that we would be developing a separate measure for family services staff, but rather that family services staff and Head Start programs could use the provider-teacher measures. However, as early on as in the focus groups and throughout the later stages, we saw evidence that suggested that family services staff really needed their own separate survey. Because the family services staff survey was not expected from the beginning, it did not go through all the stages of development that our other measures did. Notably, while the family services staff survey were cognitively tested, they were not pilot or field tested, and thus we don't have psychometric data to report on those measures. So now a little bit about for whom the FPTRQ measure are useful for. The FPTRQ measure can be used by state and local administrators to inform the development or revisions of quality rating systems, and also to better align professional development system competencies. They can be used by practitioners, professional development systems to identify and monitor the quality of relationships and to revise, focus, or develop training or coursework to address areas of weakness, as well as to understand program progress in relationship building over time. And lastly, they can be used by practitioners to test the association between provider-teacher attitudes, knowledge, and practices, as well as specific child and family outcomes, as well as to serve as reliable and comprehensive measures. And now I'm going to turn it over to Toni, who's going to talk about the conceptual model that was developed for this project. Toni?
Thank you, Lina. Hello, everyone. Now you have in front of you a very, very elaborate conceptual model. And before we start to talk about it, I want to tell you a little bit about how we got here. As Lina indicated earlier, we did an extensive review of the theoretical and empirical literature on family-provider-teacher relationships from a very broad range of fields, including early care and education and K through 12, social work, mental health, and early intervention. So what's in effect behind this model is the integration of common and unique elements from three broad perspectives on family and provider-teacher relationships: family-centered care, parent involvement and family engagement, and family-sensitive caregiving. So those three perspectives had several different elements in common, and these elements included an ecological view of child development, a focus on child outcomes through direct and indirect pathways, a focus on peer and social supports for adults as well as adult outcomes, a strengths-based approach to relationships with families that focuses on families' unique resources and assets, and the centrality of family-provider-teacher relationships. Each of these three perspectives also had unique elements which we've incorporated here: the importance of family capacity and empowerment, a focus on strong school-family partnerships and shared responsibility for children's learning, and an emphasis on provider-teacher responsiveness and sensitivity to working families. So now let's take a look at this model. You can see the two-way arrows, and that indicates that the model is bidirectional. That is, families may be more likely to become engaged and involved in their children's development and learning activities when they feel supported, understood, and empowered by programs and providers. At the same time, programs and providers and teachers may become more sensitive and responsive to the needs of families as parents become more and more involved and engaged in programs. So this model is structured as a logic model to summarize a complex issue, and each construct has the potential to be dynamic. Because the purpose of developing this conceptual model was to inform the development of the FPTRQ measures, the central focus here is on the second column, elements and constructs of effective provider facilitation of family and provider-teacher relationships. You'll see that there are four constructs here: attitudes, knowledge, practices, and environmental features. Attitudes refers to providers and teachers' perceptions or beliefs related to interactions with families. Knowledge refers to providers or teachers' specific knowledge about individual families. Practices relates to communication, responsiveness, that is the way that folks interact with families, and several other outcomes. And finally, environmental relates to the programs, policies, and resources and supports that foster family provider-teacher relationships. You'll also see here the first column, which shows the factors that influence the relationships, and the third and fourth columns, which show what the literature indicates are possible outcomes and effects from positive family provider and teacher relationships. Next slide, please. So now we're really focusing on this effective communication of provider relationships with families. So in attitudes, you'll see that there are four elements: respect, commitment, which means sensitivity to the needs of children and parents and families; openness to change, which means the willingness to alter normal practices to be sensitive to an individual child, parent, or family; and understanding context, which means having an appreciation for that broader context in which children's development and family lives are situated. Knowledge I discussed earlier, and now we look at practices. Communication is this kind of bi-directional, reciprocal communication between providers and teachers and parents. Responsiveness, flexible, sensitive, responsive support of families, including their work-family balance. collaboration, joint decision-making and goal setting, and family-focused concern, which is communication that demonstrates interest in the family as a unit. In the environmental construct, we have 5 factors, 5 elements. The first is welcoming, and that includes parent participation in decision-making activities for the program, communication systems, culturally diverse materials, information about resources, and peer-to-peer parent activities. Cultural sensitivity is assumed across all of these constructs. Lina?
Thank you, Toni. So now I'm going to be describing the measures that were developed in some more detail. The first is the provider-teacher measure, which is intended for providers and teachers of children from birth to 5, again in center-based programs, family child care, as well as Head Start and early Head Start programs. And these questions, we ask teachers and providers in this measure about how they work with parents of children that they care for. The measure includes roughly 60 items and takes about 10 minutes to complete on average. And a couple of things that I want to point out. The first is that the measure asks teachers to report about how they work with or their relationships with all the families of the children in their classrooms or the children that they currently serve. So it's not asking teachers to report about Janie's family, but rather to report about the 20 families, their relationship with the 20 families they are currently working with. The other thing that I want to point out is that we took a lot of, we worked really hard to try to have parallel items across the surveys. So for example, in the teacher survey, we have a question that asks, since September, how often have you met with or talked to parents about the goals that parents have for their child? And you would see that in the parent measure, we would have a parallel item that basically asked parents how often they met with their child provider or teacher about the goals that they have for their child. So you'll see some parallel. And next slide, please. And so now the parent measure. So the parent, again, is intended for parents of children in early care settings. And obviously it asks parents to report about how they work with their child's provider or teacher. This measure is available in both English and Spanish. It includes 75 items and takes about 10 minutes on average to complete. A question that we asked parents, a sample question that we asked parents is, how often does your child care provider or teacher work with you to develop strategies that you can use at home to support your child's learning or development? So one important distinction between the teacher and the parent survey is that while the teacher is asked to report about their relationship globally with all the families in their classroom or in their setting, those that they're currently working with, parents are asked to report specifically about the one provider. And in fact, in the measure, they are instructed to report about if there's multiple providers in the classroom, for example, to report about the lead teacher. And the reason that we did that for the teacher is that it would be too burdensome on teachers to have to report on each of the individual, let's say they had 20 children in their classroom, report on each of the individual 20 relationships. And then the director measure. Again, the director measure is intended for center-based family child care programs as well as Head Start and early Head Start programs. And we've been getting a lot of questions about whether these measures are only intended for Head Start or early Head Start programs, and the answer is no. I think just hearing the words Head Start, people start thinking that it's just for Head Start, but it is not intended for just Head Start. It's intended, in fact, for across all these different care settings. It asks directors, and in family care programs, it would be sort of the owner or the quote-unquote boss. It asks respondents general questions about the education of the staff as well as environmental features and program policies, things that teachers, individual teachers, and staff members don't set, but they're really set at the organizational level and help to set the tone and provide the context under which family provider relationships can be fostered. It includes 57 items and also takes about 10 minutes to complete on average. And you may be asking yourself, why does everything take 10 minutes to complete on average? The reason the director survey also takes 10 minutes, even though it has much fewer questions, is because they at times may have to refer to records, or they may have to do a lot more, not a lot more, somewhat more complicated math or recall and reporting in their answers, because they're reporting about all their staff. A sample item is, which of the following methods are used to communicate with families? Is it websites, email, etc.? And now I'm going to turn it over to Monica, who's going to describe how we developed the family services staff measure.
Thank you. As Lina mentioned earlier, originally the provider-teacher measures was developed to be used with Head Start family service staff. However, we learned early on from focus groups and cognitive interviews that the provider-teacher measure items were not applicable to family service staff. Now, given the important role that family service staff play within the Head Start mission, such as helping parents reach their own personal goals or supporting families by advocating for them and connecting families to community services, we decided that we needed to develop separate, specific measures for family service staff. Well, in addition to adapting provider-teacher measure items and developing new items where gaps existed, we also consulted the literature, interviewed with Kiersten Beigel from the Office of Head Start about the family service staff roles and responsibilities, and conducted 2 iterative rounds of cognitive interviews. The family service staff measure is intended to be completed by Head Start and early Head Start family service staff. It asks respondents questions about how they work with parents of young children in the program. It includes 113 items, 18 of which are demographic items. It should take about 15 minutes to complete on average, and a sample item is, since September, how often have you been able to follow up with parents about goals they set for themselves? The Parent Family Service Staff measure, designed for parents to complete about their Head Start and early Head Start family service staff member. It includes 76 items, 10 of which are demographic items. And please note that we say family service staff when referring to the role in general. However, when we refer to a specific person on the measure, we use the term family service worker. The Parent Family Service Staff measure takes about 10 minutes to complete on average, and the sample item is, since September, how often have you met with or talked with your family service worker about how you are progressing towards goals you have set for yourself? We envision that the family service staff measures can be used concurrently with the provider, teacher, and director measures. In order to gain the full perspective of the family service staff and parent relationship, we think that it's best to administer both the family service staff and parent family service staff measures. Because the family service staff measures were not included in the pilot or field studies since we began their development halfway through the project, these measures were not included in the psychometric testing. So for future work, we think it would be best to test questions in a study to establish reliability of the measures. Because the family service staff measures were not included in the field study, items have not undergone psychometric analysis to confirm construct assignment. Instead, we made our recommendations for family service staff construct assignments for all items based on conceptual model and parallelism with other measures. On this slide, you will see the number of items assigned to the family service staff measure, then the parent family service staff measure within parentheses. The constructs with asterisks denote the constructs that were not included in the parent family service staff measure. Now we'll turn it to Kwang, who will discuss field study recruitment.
In spring 2014, earlier this year, we conducted field study to collect data to examine psychometric properties of the FPTRQ measures. We selected 6 cities for the data collection. First, we sent out pre-notice letter to programs in the area of the 6 cities to informing them that we will be coming to the area to help their support our data collection. And once we got there, we make phone calls to program director asking for their participation and those who agreed to participate, we made arrangements to schedule site visits the time that are convenient for their staff and parents. We work very closely with directors. We recruit provider teachers and parents in the program. And once they are recruited, we hand out the measures to them and ask them to complete the measure and send back to Westat to process. We collect the data and we start doing some analysis to find out the psychometric properties. For the provider, teacher, and parents measure, the initial construct and subscale structure was developed based on the conceptual model as Toni mentioned earlier. Items in each of these measures were grouped under the three broad constructs: knowledge, practices, and attitude, and subscales within them. Confirmatory fact analysis was then conducted with the data from each of the measures to finalize construct and subscale structures. We used Cronbach alpha to measure internal consistency of each subscale. The reliability estimate for most subscales within the two measures, which are the provider-teacher measure and parents measure, were very strong, with Cronbach alphas of 0.70 or higher. I will show you a few tables to show the reliability estimate. This slide is for provider-teacher measure reliability estimate by program type. The construct column, the first column shows 3 constructs, and second column shows 7 subscales in the provider-teacher measures. And I will give you a few seconds to digest a lot of numbers there. And as you see there, the reliability estimate of the subscales are very strong, and in most cases, but some are a little bit lower than anticipated. Especially these commitment subscale reliability scores are low, so we look at more closely to see what's going on those subscale items. And we found that the variability among responses for the commitment subscale were very narrow, so that meaning that many, but not all, provider teachers answered 3 or 4 response which are agree or strongly agree to those items in the subscale. So, in other words, I think a lot of provider teachers are very committed to their jobs, but not everyone says the same thing. The next slide shows similar information for the parents measure by program type. 3 same construct: knowledge, practices, and attitude, but we have 8 subscales for the parents measure as shown on the table. And the reliability of the parent subscale measure show very strong across 3 different program types: center-based program, Head Start, Early Head Start, and family child care programs, with most of the Cronbach alphas over 0.90. Next slide, as Lina mentioned earlier, we have 2 versions, language versions of the parents measure, English and Spanish. And this table shows the reliability estimate for Spanish and English version of the parents measure. As the English, and as shown in the table, they were very strong, and the most Cronbach alphas were over 90 for 6 of the 8 subscales shown in this table. Director's measure, unlike the provider-teacher parents measure, is not grouped into subscales. The purpose of the director's survey is to provide context for parents and provider teacher measure, and it contains an environmental and policy checklist of yes/no items indicating the presence of potential support for families available at the program. So it was, since the yes/no items are included in the checklist, it was not appropriate to conduct reliability tests. Next slide shows how you can access FPTRQ. FPTRQ versions of all measures can be downloaded from the OPRE website at no cost to you. If you run this information, the software will be available later in the fall, and you can, when also you'll be getting some Excel scoring sheets for the director, provider, teacher, and parent measure will be available on the same website. And most importantly, FPTRQ Measure User's Manual will be available, which will include a lot more information that I'm presenting right now because of the limited time available, but you will be getting a lot of other information, useful information for you to know about the measures. Before using the FPTRQ measure, you want to download the measures from the OPRE website and make hard copies. Also, you want to develop a systematic linked measure ID system so that provider teacher link to their programs. Especially, it is important for when using multiple program sites in using this measure, and parents link to their provider teacher and program, and write ID in or put label, ID label on the space provide on the back of the measure. Administering the FPTRQ measure is very straightforward, and it's not anything much different from most other measures like this type. It is self-administered measure. It is respondent names, and we have a few suggestions for you when administering the measures of FPTRQ. Respondent names not needed on the measure, and because you may probably want to use the numeric ID system, and someone other than provider teacher will collect parents' measure so that parents feel very comfortable filling out the measure. And finally, can give parents even maybe envelope for them to insert their complete measure when return their complete measures. Scoring the measure is probably the one that I think you are wondering how to do. And to help you to do the scoring, Excel scoring sheets for director, provider, and parents measure will be available on the OPRE website. All you need to do is enter the measure responses into the spreadsheet, and it will automatically calculate subscale scores for you. Measure responses in Excel can also be analyzed by using statistical packages such as SPSS or SAS if you prefer to use those statistical packages. Some reverse scored items are included in the measures, and the information about what items should be reversed included in the user's manual. And you will find other useful information about the measures in the user's manual, as I mentioned earlier. Finally, I just want to give you a few limitations of the FPTRQ measure. The first is the field study data was not nationally representative, and almost all Head Start programs in the field study were run by community organizations, and a very small number of early Head Start programs were included in the field study. FPTRQ measures data has not been examined with any outcome data yet, so we do not have predictive validity information for you. No concurrent validity study of the FPTRQ measure has been conducted yet, and due to difficulty measuring cultural sensitivity, as reported by Manica earlier, it is measured indirectly across the subscales. Lina?
Thank you, Kwang. So now I'd just like to sort of summarize briefly some of the key points of our webinar and our measures. First, I hope you really come away with the sense that the FPTRQ measures captures. Oh, I'm sorry. Toni? I'm sorry. I skipped you. Sorry.
Lina was so eager to share with you all these wonderful things about the measure that we just sort of skipped over this. So I'll be really quick because I'm sure throughout this whole webinar you've been thinking about how you might want to use the measure. Next slide, please. So if you're a professional development system administrator, you might think about considering using the FPTRQ conceptual model as a basis for taking a look at the competencies that you've identified for practitioners in their relationships with families. And in doing so, you might identify some gaps in the competencies that you have already articulated, and you can use the FPTRQ conceptual model constructs and subscales as a way to fill those competencies. In addition, you can take a look at the training and coursework you offer to see how it aligns with the constructs and subscales in the FPTRQ model. And finally, you can design new training and coursework to fill those gaps which you may have identified in your competencies or in your alignment. You can also use the FPTRQ measures alongside of other measures such as the strengthening family self-assessment to better understand areas in which practitioners may need additional support. Next slide, please. So if you're someone who works directly with families, whether you're a director or a family child care provider, an early Head Start teacher, a teacher, how could you use this? I'm sure you've already been thinking, wow, if I use this assessment, the FPTRQ measures, we could figure out how to assess our own attitudes, knowledge, and practices for working with families. And we could then identify those areas that may warrant some attention. We could also use the FPTRQ measures for understanding parents' perceptions of their relationships with families in our programs. And we could combine the results of the FPTRQ provider-teacher survey with those of parents in order to see what the fit is between providers and teachers and parents in their perceptions of their relationships with each other. In addition, you can use the FPTRQ measures to identify aspects of effective facilitation of relationships with families that may not have been considered. And that goes back to what we said earlier about the fact that the FPTRQ conceptual model includes all of the elements that are associated in the empirical research with positive outcomes for children and families. And finally, within your own programs, you can use the results of the FPTRQ measures to guide professional development and targeted training around those areas in which you all feel that you may need to improve. Lina.
Thank you, Toni.
You're welcome.
As I was saying earlier, I hope you walk away with a few things, a few key points. The first is that our new FPTRQ measure captures provider-teacher perspectives on all families and parent perspectives on individual teachers. So again, From the provider-teacher perspective, we collect information through these measures about all the families that they serve. But on the parent perspective, we collect information on the individual teacher. This can then be aggregated at the classroom level or aggregated at the program level. These measures, again, are applicable across diverse settings, including centers, Head Start or early Head Start programs, family child care as well. We've gotten a few questions about whether these measures are applicable or appropriate for use in pre-K, and the answer is yes. Because of the difficulty of getting into public preschool schools, we were not able to explicitly test them with pre-K classrooms. However, there's no reason to believe, based on what we have seen, the feedback that we have gotten, as well as the research literature, to suggest that these would not be applicable for public pre-K programs. Our measures, again, are appropriate for diverse populations, and not only are they appropriate, we developed them in mind and we developed them in mind with diverse populations in mind, and we tested them with diverse populations. And we also have measures that measure multiple constructs, including attitudes, knowledge, practice, and environmental features. And these measures are really intended to be flexible to facilitate their use in either on their own as a standalone measure or as a part of a monitoring or evaluation process, as Toni was talking about. In the next slide, we just have a few links. And again, you do not need to copy this down and write furiously. That includes some of the products that have already been released from this project, as well as some of the products that were developed actually that predated this project that Laura was mentioning earlier today. And then on the last slide, we have OPRE's website, where you will be able to find later this fall the user's manual, the measures, and several briefs that we're developing, including one that provides sort of a crosswalk between our conceptual model and other models that have measured family provider-teacher relationship quality, as well as a brief about how to measure cultural sensitivity in early care and education settings. And these products will be available both on OPRE's website, but also on Child Trends' website, as well as Research Connections. And again, no worries about having to write down everything as I speak. We will be sure to email everyone who registered for the webinar to let them know that these tools become available, and we'll be providing links in those emails to where you can access the various tools. And now I want to turn it over to Alicia, who's been writing fast and furiously, trying to organize the questions that we've been getting around similar topics so that we can cover as much as we can in the remaining 11 or so minutes.
Wonderful. Thank you, Lina. Well, following up on one of the questions that you did respond to, Lina, there are also others asking whether or not these measures could be used in, not just in public preschool, but in middle schools, other grade schools, higher grades in grade school. So there's a question related to that too.
Toni, do you want to take that? Or I can answer it.
Yeah, I can take it. Well, when we developed these measures specifically for early care and education settings, and as we all keep saying, it was for most early care and education settings. But from a conceptual perspective, it may be that these measures could apply certainly to teachers in the early grades, K through third grade. They're probably less relevant for middle and high school, although the basic elements of a strong relationship between families and providers, or, well, in this case for school-age children, it would be teachers, or after school, frankly, remain the same pretty much, because we identified those elements through a review of the K through 12 literature, as well as the early care and education literature. Alicia, other questions?
Also, the psychometric properties information provided in the user's manual comes from children age 0 to 5. The parents report that information, and we are using that data to calculate the reliability estimate. So it could be different if the the parents of children older age answer the question, the measure.
Great. Well, here's another question. For families with multiple children in multiple classes, would they have to submit a survey for each teacher or class?
I think because it is even though you are just one parent, but your children are in multiple classes with different teachers, it probably is important to collect the information from different the different teachers, providers, and the parents may need to complete the measures all for each teacher actually, because the experience will be quite different.
Mm-hmm.
Anything?
Yeah, no, I completely agree with that. So for the parents, because it's very much intended to be about a specific teacher, for those with multiple children in different classrooms, then they should be completing a survey for each of their child's teachers. So if they have two children, they complete 2 surveys.
And one related question that just came in, can this assessment be used in family child care settings? I believe that that was addressed in the presentation, but
yes, the answer is absolutely. We took we made a really concerted effort to make sure that the measures were going to be applicable for family child care settings, and that was throughout, from our conceptual model to how we thought about measuring attitudes and knowledge. We wanted to make sure, for example, that we really that our measures ultimately captured the unique features of family child care and didn't penalize them necessarily, for example, for not looking like centers, but also really captured the real strengths that they bring. Toni, do you want to add anything to that?
Yeah, I do. I think one of the strengths of the measure is that it does apply to family child care, which can, as you all know, look very, very different than center-based care. And I think that not only did we design this measure, design the items with family child care specifically in mind, as Lina indicated, but you can see through the psychometric testing that it held up pretty well. Wouldn't you say, Kwang, in family child care?
Right.
So yeah, you can use this in family child care with a great deal of confidence.
Mm-hmm. Okay, another question, will a web-based version or PDF fillable version be developed?
Right now, it is the printable version, PDF version will be available on the OPRE website, and there is no plan for developing any different format at the moment, and it will not be available as far as I know.
Will this be mandatory for programs to conduct these measures?
So as far as we understand it, and we have no reason to think otherwise, these will not be mandatory. But Laura, maybe you might have additional information.
I actually don't, and I would say that I have not heard anything along those lines at all. So definitely no.
Okay, and there's another question with respect to the demographics of the representative sample.
It's not statistically, we did not statistically select the sample respondents for the field study, but we made all effort to recruit diverse samples, including race, ethnicity, their in-family household income, education level, and from different types of program and different location across the country, so that it is as close, but it is not nationally representative sample.
Okay. And for Manica, are these surveys available for providers who speak Spanish? And do the surveys look at cultural sensitivity?
There are parent surveys that are available in English and Spanish. The provider surveys are not available, and they're only available in English. As far as culture sensitivity, because culture sensitivity can be conceptualized in different ways, and during this project we conduct an investigation on what culture sensitivity looks like between provider and teacher and parent relationships. We found that culture sensitivity can be measured as attitudes, knowledge, and practices, which are the same elements that characterize a quality relationship between providers and teachers, teachers, and parents. So we ultimately concluded that cultural sensitivity is best measured through various elements and constructs rather than directly through items on its own subscale.
Great, thank you. And for Kwang, can we use the survey to develop training programs for our teachers and family service workers?
I think certainly, but Toni may have better insight and even some suggestion how to use this for the training purposes.
Yeah, I think that there are a couple of different ways. I mean, we're not going to propose or send you in the direction of specific training programs, but I think if you use this survey within your own program and you identify through the survey areas, such as practices or within practices, for example, collaboration or responsiveness, that look like there could be some improvement. There are lots of options out there, including the National Parent, Family, and Community Engagement Center, which have materials that you can use for technical assistance and for training. So this is a terrific opportunity to improve the professional practices, and by that I mean the attitudes, knowledge, and practices of staff in both family child care programs, center-based programs, and in Head Start and early Head Start programs.
Great, thank you, Toni. We have time maybe for another couple questions. Can we use parts of the survey instead of the whole survey?
Depends on your specific needs to use the FPTRQ measures, and the measures been designed to use as a whole, but also it can be, you can select a few items or subscales from the whole measure and put them in your existing battery. And I think that may save some time, but it is better to use the whole thing to get more comprehensive picture of the relationship quality.
Great. And then finally, and this seems to be a question more from a researcher, but I know this kind of data would be very sensitive, but wonder if global outcomes could be gathered for research. He's also asking about she's also asking about the pilot field testing. Were there any overarching needs or issues that you noticed?
I think it would be great if you have an opportunity to make even a larger, project to do some for the examining the measures and developing in this area. But we have about 1,100 parents, about 450 provider teachers, and 250 directors in the field study, and it was so those are the kind of sample size for the field study to examine the psychometric properties of the FPTRQ measures at the moment. The second question has to do with the second part is
whether the data would be available.
Oh, well, another thing actually is that we didn't actually have any serious concern or problems or whatsoever during our field study data collection. It was relatively short measures, so the parents as well as teachers, providers, we got very, very high cooperation rate from the respondents. And but this data set that used in the field tests will not be available for public use because it was exclusively and statistically collected for the psychometric properties. So, yep.
Well, great. Well, we're just about a minute over, and we want to thank all of you who have logged on to join us this afternoon, and thank the panelists and Laura for a very interesting webinar.